Good morning, everybody. Thank you for your time. We are a team from the Whittington Hospital in North London. My name is Meg Wilson. I'm a consultant obstetrician and I'm obstetric lead at the moment. And Caitlin.
Hi, I'm Caitlin. I'm Assistant Service Manager for Women's Health.
Lovely. And we're representing a bigger group. We had a lovely multidisciplinary group working on our project. We had the admin team, community midwives, resident doctors, and a lot of input from a very motivated consultant midwife as well. We've focused a project that is the delivery of antenatal care by joint appointments between midwives and obstetricians using technology of video consultations. And essentially, this was multiple inefficiencies that we knew we work with in the service, with multiple motivations to have the opportunity to change how we're delivering these appointments. But essentially, this streamlining of appointments and care of delivery care also has a very positive environmental impact by improving accessibility and the use of resources. So this slide is to summarize rather rapidly, because I know we're against the clock with our presentation, the multiple achievements we wanted with this form of appointments, but essentially the current system being that women attend to see doctors in the antenatal clinic, usually based in the hospital, and we have a hospital-based antenatal clinic, but in the same week they may be visiting their local community centre to visit the midwives and have a duplication of tests and information given. And actually a lot of the tests and information could actually all be collaborated into one appointment, where the woman could go to see her midwife in the community centre, and we as the obstetricians could give our medical impact input over a video consult using Teams technology. And it was pretty straightforward concept that we came up with sort of hopefully multiple gains. And the gains that we had, I've written the green ones as the sustainability themes, really the repetition of repeating tests and using the supplies that we use routinely at each appointment, disposable medical equipment, and the carbon footprint that generates. And also considering the travel to these appointments. And alongside that, these should potentially all be in green, but the time taken out of families sort of working and childcare schedules with cost savings, reaching other socioeconomic groups that don't necessarily have the time to be traipsing back and forward to multiple appointments, patient satisfaction, and improved birth outcomes as key factors, and very positive response about collaboration with working with midwives and doctors. These clinic appointments and locations can sometimes be quite solitary, and we have, as most NHS services do, issues with morale and motivating people to stay in the profession. And this team working is usually a theme of safe and good practice and motivation amongst the team, and providing contemporary healthcare, utilising the technology we have. So we're excited about this project on many levels. I'm going to let Caitlin say what we actually did.
Thanks, Meg. So here we have our picture of Mount Everest, because at certain points it did actually feel like that. Making a change in a sort of established environment can obviously be quite tricky, but we managed it in the end. So what we had is lots of different meetings with our MDT team to talk about which patients were going to be the patients that we could have these sort of joint appointments for. And like Meg said, we focused on patients who would, the consultant obstetrician appointment was very much information based. So for patients who were over a certain maternal age or C-section discussions, etc. So what we did is we identified those patients. We created a pilot using our different team members who were involved. after that pilot, we had a lot of information from both the patients, the people who were working in that MDT team, to try and get as many sort of results as possible to try and push this forward. We also registered the project for our own internal QI trust sustainability. We then led to the coordination of these appointments, and then we calculated the carbon footprint with the help of the wonderful Rachel and Inika, and we really want to say a huge thank you, because you really have helped us with our project a lot. So yeah, it seemed a fairly simple idea, is to have 2 appointments, changed it to 1, but there was a lot of challenges along the way, but we really feel like we have created something that a pilot that we can use to display to everyone, to say, look, this is what works, and we want to try and help that going forward. So just to kind of focus on the actual results, so the 3 main points that we have here is that we have a patient survey where we have managed to understand how many what the average time to travel to the hospital would be, and how much people were taking public transport, how many people were taking the car, and that was really great information to use in terms of looking for other aspects. And another really key point is that 100% of the patients who we asked in the survey said that they would be interested in a joint appointment with an obstetrician and a midwife, and that's, I think, some really key parts of information. I won't go through all the carbon footprint here, but the quote that got me is that this would be the equivalent to driving 679 miles in a car, which I think that's a pretty big saving. And also the economic sustainability as well, because, you know, in the current climate, a lot of the trust is talking about saving money, and it's really nice to have that sort of work hand in hand with economic sustainability as well as environmental sustainability. So moving on, because I know that we're a little bit short of time, we really wanted to focus on what the future developments would look like, and it's something that us as an MDT team are really keen to be, that this doesn't stop here. We don't just stop thinking about it when the project is over. We have a think about what other parts we can do to try and make our environment much more environmentally friendly. We've already spoken about sort of how we can monitor and evaluate our environmental impact. I think our next big project is going to be talking about gloves and how we can reduce the amount of plastic gloves that we use. We want to continue to be proactive about sustainable practices, and it's inspired us to reach out to other colleagues and start conversations throughout maternity. We're very lucky at the Whittington that Hugh Montgomery is a huge part. He's part of the international COP discussions, so he's been very supportive of the project and talking about how else we can sort of move this to start from just from a pilot to a larger part in the whole trust. So thank you very much.
Brilliant. Thanks so much, Caitlin and Meg. Any questions from the judging panel?
I wondered what you think the opportunity is for extending this to other patient groups.
Yeah, I mean, I think that would be our hope. I think one of the things that we've really enjoyed about this project has been the opportunity to get involved with other clinicians in the hospital, because we've started the conversation going, we're doing a sustainability project in maternity. We've taken it out and spoken to other people, and Hugh Montgomery's an ITU consultant position at UCH as well. So we've taken the opportunity to start sort of shouting our corner. Whether the project itself would be relevant for other groups, I suppose we are a little bit unique in maternity in that we've got midwives and obstetricians practicing, you know, unfortunately in this case, too independently, and we should do this joint appointment. But I can imagine that it would be translatable. The other thing that I'd be excited to explore is other units and how they would use it. We're in North London, we're in N19, we're quite central. So actually there is a convenience to it that everybody's relatively local. It's more the time saving of just repetition of information and use of the test products in the clinic. But other more rural communities may really be interested from a different perspective about reaching out to people. And ultimately we're all here to deliver safe and sustainable healthcare. And I think there is a massive safety aspect to this as well.
I've got a question if there's time for one more.
Yeah, absolutely.
Yeah, I'm just curious to know, really great initiative, and it makes so much sense, doesn't it, when you see it laid out like that? Why don't we do this all the time? But I was just curious to know, how did you engage with the obstetricians, with the midwives, and with the women that were receiving that care? And has that had any kind of impact in terms of their satisfaction and how they deliver the care or receive the care?
Yeah, we use patient surveys for that bit of the that bit of our project. So we got survey information back, and that is always it has its limitations. Overall, from the obstetrician midwifery point of view, we have very positive verbal feedback. Everybody was on board, and as you very kindly said, that makes sense, and there was an appetite for it. The reality is that when we piloted it, like all of these things, your first try at these things is sometimes clumsy, and it unveils certain aspects, such as there is a little bit more appointment time. So, I was involved in one. The midwife said, look, this was all great, but you've taken up quite a lot of my time in my clinic with your chatter. So, things that need to be ironed out. But what I found actually incredibly gratifying was the midwifery response of just sort of coming to us and saying, this is collaboration, this is what we're meant to be doing, we're all meant to be working together. And that felt like we'd actually sort of taken a positive step to what people want working there. The patient point of view, we had a few questions that we sort of opened up to comments, and it was very interesting getting patient point of view. They were 100% tick the box to say, yeah, we're really interested in a joint appointment. But there was an anxiety in some of the responses where we said, are you worried about coming up to the hospital as much from an environmental point of view? And people had an anxiety that perhaps this was a project that was trying to reduce the number of appointments they had. So we got lots of comments saying, I'm very anxious about my pregnancy. Every time I see somebody, it's a good thing, and so it's always interesting, these conversations, and where people sit with what they want. So